I'm Kate Chaplinsky for the HAN Network. September is National Pain Awareness Month, and we're at Silver Hill Hospital in New Canaan today talking about different ways to manage chronic pain. And I'm joined in that discussion by Dr. Dorothy Mueller. Dr. Mueller, so happy to talk with you today.
Thank you for the opportunity. I'm happy to be here.
Now, we want to talk about some of your suggestions for different ways to manage chronic pain, one of which is mindfulness. But can you describe to us what that means?
Sure. At our program, mindfulness-based stress reduction is incorporated into the self-management pain tools that we teach our patients. And mindfulness-based stress reduction was developed by John Kabat-Zinn, a professor at UMass Medical Center in the 1970s. And it incorporates relaxation techniques, meditation techniques, as well as gentle yoga and body awareness. And what mindfulness means is being present, not trying to change what's going on, not even trying to change negative thoughts or emotions. And it's evidence-based. So its research supports the fact that it has benefits in terms of increasing coping ability, even coping with and managing pain, as well as stress reduction, emotional regulation, because when we react, if we get angry, that increases our experience of pain. And so it's really an amazing tool. And typically it's offered as an 8-week course, and we refer our patients to that once they graduate from our chronic pain program. And it is something that, you can do on your own as well, those techniques. And for 10 to 20 minutes a day, you'd be amazed at the benefits of that practice.
And now another tip that you talk about is support groups. How important is that?
Support groups, as we know, Chronic Pain Anonymous actually is something that a lot of people aren't familiar with. It's a 12-step based recovery group that actually Silver Hill is one of the first pain centers on the Northeast to offer that as part of the program. And what it is, it's an opportunity for people who are living and struggling with chronic pain to come together, talk about their experiences, share their knowledge about what it means to be living with this situation, and also identify ways to cope with it. And so it's support. People get a lot out of sharing, and it is available to anyone. Most times you can go onto the website, chronicpainanonymous.org, and you can log in and do video chat or internet-based meetings or telephonic meetings. But of course, we prefer live, but they're rare. And so Silver Hill really is one of the pioneers that started the groups, and they were formed by former graduates of our program. So we offer 2 on Monday nights as well as Thursday nights. Monday night is a closed group just for our patients. And then Thursday night is an alumni group where it's also open to the public.
And another tip that you talk about, which may sound counterintuitive to someone who experiences pain, is being active and exercising. Why is that so important?
Well, for any of us who are struggling with depression or anxiety or chronic pain, endorphins are produced when we exercise. And so it's an amazing opportunity to deal with overall physical conditioning. A lot of times patients with chronic pain or people with chronic pain tend to be lying down a lot. They're not conditioning and toning their muscles. And increased activity, as gentle and progressed, is a way to manage that. And we also talk about the difference between sore muscles and actual pain. So here at the chronic pain program at Silver Hill, our patients engage in physical therapy and also aquatic-based therapy. And I know we're sitting where our pool is, so you don't want to pan the camera right now, but we have a physical therapist who works with our patients in an individually tailored way and supervises them in both land in the gym, exercise, as well as physical therapy in the pool, the aquatic therapy. And it enhances people's conditioning as well as the buoyancy, which absolutely helps to manage chronic pain. And when someone graduates from our program, we let them know that it's really important to do that activity at least 3 times a week.
And now, where do you suggest maybe people get more information about some of the programs here, and especially about that public meeting on Thursday evenings?
Oh, sure. Well, in terms of the public meeting for Chronic Pain Anonymous, they can go to chronicpainanonymous.org. There's also another resource, the American Chronic Pain Association. There's also a link to the website. If you log on and Google it, you'll find amazing resources, a lot of articles, and important information and support groups for people with chronic pain as well as their families, because as we know, it also impacts the family and emotional health and mental well-being.
All right. Well, Dr. Mueller, thank you so much for talking with us today.
Thank you so much. I really appreciate it.
All right. And you can find out more about our partnership with Silver Hill Hospital this month at han.network.